I came back with another NEET PG question. This topic is not frequently asked, but recent years they started asking this. So I thought, why don't I try this concept? So the question goes like this. A 68-year-old woman presents with chronic vulval itching for several years. Examination reveals a 2 centimeters ulceroproliferative lesion on the right labia majora. Biopsy confirms squamous cell carcinoma. Which lymph node group is most likely to be involved first? So you have four options here. Option A, internal iliac nodes. Option B, external iliac nodes. And option C, superficial inguinal nodes. And option D, para-aortic nodes. Think it you can if you know the basic anatomy of vulva, you can easily get this answer correct. Think and comment your answer.
Be able to answer the question, and not only the question, you will be able to answer most of the questions asked on this concept. It's very simple here. You need to know few points to answer this question. So, vulval squamous cell carcinoma. This is a most common malignancy of the vulva. Why? Because vulva is lined by stratified squamous epithelium. So, obviously, the most common cancer will be squamous cell carcinoma. There are some other things, but that's not needed here. And this is most commonly seen in elderly women more than 60 years. That's why our question mentioned a 68-year-old woman. Before getting with the question aspects, let's see what are its risk factors. HPV infection and especially type 16. This has been asked recently in NEET PG exam. So it's better if you remember it, you are going to benefit from this. And lichen sclerosis, vulval intraepithelial neoplasia, smoking, immunosuppression. So there are other risk factors too, but these are important things you can remember. And coming to the clinical features, persistent vulval itching. So it's even given in the question, and this is the most common clinical features you see here: pain, discomfort, ulcer. You may and see any growth, and sometimes bleeding or discharge also may happen. But the most common, just remember, persistent vulval itching. So, the most common sites of the cancer, vulva cancer, is labia majora, and then followed by labia minora, and clitoris is least common here. So, if you can just see here, uh, if you wanna know the anatomy, this outer lips are called labia majora, sorry, and the inner lips are called labia minora, and this inside part is vestibule. This one is clitoris, and yeah, just for reference, yeah, posterior side anus is there. So this is basic anatomy. Yeah. So coming to the lymphatic drainage, 3 points. First, lymph nodes is superficial inguinal lymph nodes. Then it reaches deep inguinal lymph nodes. We also call this as femoral lymph nodes. And then it reaches external iliac lymph nodes, also known as pelvic lymph nodes. So this is how the order goes: superficial inguinal lymph nodes, deep inguinal lymph nodes, and external iliac nodes. So the sentinel lymph node is superficial inguinal lymph nodes. So the answer for our question is already here. So superficial inguinal lymph node is the first lymph node to be involved. Yeah. So this is how the lymphatic drainage of the vulva goes, and then common iliac nodes, para-aortic nodes that are not needed for our exam. And next, most of the vulva, like except clitoris, yeah, there is an exception here. Clitoris. Clitoris doesn't drain into superficial inguinal lymph nodes. It bypasses superficial inguinal lymph nodes and directly drains into deep inguinal lymph nodes, and that is Rosenmuller lymph node. So yeah, that is an exceptional case here. And when we see about spread, local invasion, adjacent structures, lymphatic spread, superficial inguinal lymph nodes. And the thing is, if you have to get more information about this, we can you can learn vulval cancer staging. So that may be asked as a NEET PG question. So yeah, that's how, like, that's the concept we need to learn for this question. And let's see what the answer is now. if you guys listen to the explanation, you would have easily solved this answer. So our answer is superficial inguinal lymph nodes. This is very simple anatomical question. So guys, if you find this video helpful, please like, share to your friends who are preparing for NEET PG, and don't forget to subscribe. Thank you for watching.